Welcome. We are about to start. Yes. Okay. Well, thanks for joining this Africa hearing on drug use prevention, part of a series of regional meetings to hear the voice from civil society in the framework of the global initiative on drug use prevention, what is called the Declaration of Oviedo, that I am personally contributing also to coordinate with more than 2,000 supporting organizations already. This event is organized by Uganda Youth Development Link, African Youth Initiative on Crime Prevention from Nigeria, the World Federation Against Drugs, International Federation, and Association Proyecto Hombre, where I belong to, from Spain. This initiative aims at raising and uniting the demand from civil society organizations, but also academia and increasingly governments from all over the world, that after decades of drug-related problems, the time has come to recognize that evidence-based prevention should be incorporated in drug policy at global and local level. It is a demand that stems from a real need that we see in the populations we serve every day. The stronger and more transversal our voice is, and the more coordinated we act, the more strength we will have to convince society as a whole to invest in the prevention of drug use. The message of the Declaration of Oviedo is twofold: do more but better prevention. Many experts worked for months last year to draw up 10 guiding proposals that we believe will contribute to enhance the formulation and implementation of more effective preventive strategies. And thanks to the focal points, the document is translated into many languages. The last one yesterday in Malagasy for Madagascar. All information can be found on the website oviedodeclaration.org. You will find it, the link in the chat box. I would like to greatly appreciate the commitment and voluntary dedication of my colleagues in the task force and the country focal points, as well as the organizations in 147 countries that already support this declaration. Nearly one-third from Africa. One-third from Africa. Special thanks to the UNODC and the Vienna NGO Committee on Drugs as observers, and to the African Union and all speakers and reporters for engaging to this event today. Also thanks to Cressida and Chantal who are working or organizing behind the scenes this event. Apologies to all of the other African focal points who cannot intervene today due to the limited time, as you can guess. Very active from Cameroon, Tanzania, South Sudan, Rwanda, or Egypt, among others. Presentations will be short. Speakers will be posing the challenges on drug use prevention in their countries, and reporters, Dandy Yella from WFED, coordinator in the Democratic Republic of the Congo, and Sonia Nif, also joining me in my organization, will be elaborating this report that will be distributed also to you in the following days. I don't know if you can switch on the camera, Dandy and Sonia, and because we would love to also to introduce just for a second. Are you there? Yes. Okay. Meanwhile, my last comment, just to finalize, I really encourage all of you to provide evidence-based prevention throughout Africa, particularly for children, youth, and people in vulnerable situations. And we ask governments and other stakeholders to collaborate to make it happen. Thank you so much. I'm very delighted to hand over to my colleague and friend, Roger Casiria, which is the Executive Director of MUIDEL, but also representing the Global Task Force of this initiative from Africa. So Rogers and myself will be moderating this event. Rogers, it's your turn.
Thank you so much, Mr. Orio. I want to congratulate Project Hombre, but also many others who are part of this. As a chair for now and representing our African colleagues on the African continent on the issue of prevention, I think it is very relevant. Africa is a young population. In my country alone, Uganda, over 75% are young people below 24. So, and yet the resources, the money is not enough. So it becomes a little bit tricky on how we should approach. But when the message on prevention, particularly the hearing, I think it makes it very clear for us that we need to see where do we get more mileage. And we get more mileage when we do prevention, because we save a lot of money when we do more prevention. And I know my other friends and colleagues will be elaborating on that. So Uganda and many African countries, particularly those in the low-income countries, I think prevention works very well. And prevention is the key. Whatever pathway you want to do, if you can prevent many problems happening, you have done a good service to the young people, because the cost of managing treatment may not be easy. With that, I'm going to invite our good colleague, Giovanna Campbell, from the UN ODC, United Nations Office on Drug and Crime, who is the Chief Prevention Treatment, to come, the Chief Prevention Treatment and Rehabilitation Section, United Nations Office on Drugs and Crime, to give us a snapshot on how the unit and how the global efforts would like to see prevention in this effort. Thank you, Giovanna Campbell. You are welcome.
Thank you, Rogers. Thank you, Oriol. Thank you, dear friends. It's a pleasure to be here. Basically tell you how important it is that you are all here. And being committed to implement more and expand the implementation of evidence-based prevention. Roger already mentioned how this is of particular relevance to Africa due to the high percentage of youth in the population. And we all know from the new version of the World Drug Report, if you haven't looked at it, please do pick it up. It's really rich of a lot of inspiration. And of course, the World Drug Report has indicated to us how globally the percentage of young people 15 to 16 that use drugs is higher than that in the general population. So we know how youth is a time where prevalence is higher and where it is most dangerous, because of course brains are developing. The more likely he or she is to develop a substance use disorder. And we don't have good figures as to how much good prevention is implemented worldwide. What we do know is there are 64 million people with drug use disorders globally, and that only 1 in 11 is in treatment. In fact, if you are a woman, that's worse, because it's 1 in 18 women who use drugs that with drug use disorder that are in treatment. And that access to treatment and care services has actually been decreasing in the in percentage terms, not in absolute terms, but in percentage terms, it has been decreasing in the last 5 years from 11 to 9%. So it is imperative that we invest in prevention, like the motto of our last day against drug use and illicit drug trafficking said. And I think you all know, and you will hear a lot of inspirational ideas on how to implement evidence-based prevention. And the Oviedo Declaration has made an amazing job in distilling in 10 simple but very clear demands to member states the things that need to be done to expand and strengthen worldwide according to the international standards. Here they are. I always show them. This is the summary of what works and what does not work according to scientific evidence that we have produced together with WHO, and that it is at your disposal to improve your prevention. But the important thing is also that we always keep in mind, Roger's already say, if we prevent, we save money. Indeed, evidence-based prevention is cost-effective. You save at least $10 for any dollar that you spend in evidence-based prevention. And this is a conservative estimate. I will not go into the discussion of the estimates because that would be very long. But the great thing is also that if you do evidence-based prevention, you not only prevent drug use, which is great, this is why we are here, but you also improve mental health, you decrease dropout, you decrease youth violence, you decrease child maltreatment. Basically, you're really supporting children grow healthy and safe into healthy and adults enjoying well-being. So I think that I hope that I've given you at least some good reason why to underline why it is so important that civil society. And I met Oriol only last week, and last week there were 1,900 and something organizations that had joined the Oviedo Declaration, and now you're already more than 2,000, and this is fantastic. It is fantastic that it's not only us, it's not only some member states, but that civil society really puts their strong voice behind evidence-based prevention. And let's face it, a lot of prevention worldwide is done by civil society, and it's done very well. Everything can be improved, of course, and we are at your disposal, and I invite you to connect with each other and learn from each other how to implement evidence-based prevention and how to improve your prevention. But we will go nowhere unless we join forces and we advocate vis-a-vis the decision makers in the governments to invest more in prevention. And so I very humbly thank you for this amazing initiative. Thank you for having us on board, even if only as observers. Know that we are behind you. Know that you can always call on us to support you, to give you ideas if needed, to direct you to the right research, and above all, to testify to the member states of how an amazing force this initiative is. I leave it here, and I leave you in the good hands of our moderator and our panelists, which I'm sure will provide plenty of inspiration. Thank you.
Thank you. Now over to you, Orio.
Yes, well, thanks a lot, Rogers, but particularly Giovanna. Needless to say how much we appreciate not only having you as observer, but actively involved and supportive within all this process. It is of utmost importance. Yeah, thank you so much, Giovanna, and all your team also behind. Then we move to the next presenter that will also make introductory remarks. I'm very delighted actually to introduce Dr. Abel Basutu, Senior Drug Control Program Officer from the African Union Commission based in Addis Ababa, Adaba in Ethiopia. He has been coordinating continental drug policy development and program implementation since 2010. Thank you so much for being here with us today. Abel, it's your turn.
Thank you very much, Oriol. And just to pick up from where Giovanna left off, I would want to start by reflecting on two quotes attributed to two people from the continent. One of them is the late Archbishop Desmond Tutu of South Africa, who said there comes a point in time where we need to stop pulling people out of the river. We need to go upstream to find out why they are falling in. And that speaks a lot about the need for prevention. And the second quote that I would want to reflect on is from the late Chinua Achebe, a famous author from Nigeria, who said, people say, if you find water rising up to your ankle, that's the time to do something about it, not when it is around your neck. And there are reasons for us to focus our attention on prevention, because prevention programs are reaching only a small number of people on the continent. And therefore, what is needed is a sense of agency in tackling the challenges, a greater mobilization, and building an ecosystem of allies, and finding new ways to collaborate nationally, regionally, and internationally, with the funding also. Why? Because the magnitude of drug flows is growing, and as Giovanna reflected, a 40% increase in drug consumption expected in Africa by 2030. We can only talk about the need for prevention, strengthening prevention. Our own Continental Drug Surveillance Sentinel, which we call the Pan-African Epidemiology Network on Drug Use, shows that about 70% of treatment entrants on the continent between 2016 and 2021 were aged 15 to 34. That is classified as youth according to the African Charter. And 2.3% of the individuals treated for substance use disorders during that index period were aged 10 to 14 years. And those are children, implying early initiation of substance use that occurs in some settings. And therefore, I can only emphasize the importance of ramping up prevention, evidence-based prevention. And thanks to UNODC and WHO for the prevention standards. At the African Union, we do have also supportive frameworks in the form of two declarations. One of them is called the Cairo Declaration of 2022 on addressing substance use disorders among youth, women, and children, followed by the Lusaka High-Level Session Declaration of 2023 on addressing, again, substance use and related mental health disorders among youth, women, and children. So you can see that at policy level, even the policy organs of the African Union are proactive, because the issue at hand is something that demands our attention. It's something that demands the attention of each and every organization and all of us collectively. With these few remarks, I want to thank you for giving us the opportunity to say a few words. Thank you. Back to you, Orion.
Thanks to you, Dr. Basutu. I dare to publicly also ask you if we can formally present to the African Union this final report of this session as an additional document that can also support the mission of African Union that we recognize as a central, that has a central role throughout the region. Thank you so much.
Thank you. Thank you.
I'm going to invite my brother Christoganas Ibe from Nigeria to give us some bit of perspective, because Ibe works with a youth NGO which does a lot of crime prevention and youth development as a practitioner. So Ibe, I'm going to give you 3 minutes. Can you summarize and give us a perspective how you look at prevention and why we need to prepare prevention? Thank you very much.
5 minutes, and they have 5 minutes each one. So
okay, 3 to 5.
Yeah, thank you very much. Right. Hello, can you hear me?
Yes, yes.
Oh, thank you very much, Dr. Rogers and Oriol, for this great opportunity. For us, the Global Initiative on Drug Use Prevention, Oviedo Declaration, is a welcome development for Nigeria and the entire Africans, considering the fact that we are faced with huge challenges, especially in the area of young people. Based on the fact that young people, our continent is constituted of majorly young people. And considering the poverty and the lack of job employment, they tend to go towards drugs. And this is not good for our development. We have been able to mobilize for NGOs, civil society organizations, institutions in Nigeria to be part of this global initiative. And I'm telling you that they are really welcome. They have welcomed it. The government, we are working towards taking the campaign to the government. We
Chris,
have set up.
Chris, your camera is off.
Yes, I don't know
Okay.
what happened.
Okay, just go on. No worries, go
My
on.
camera. Yes. So we have, as part of our activities to raise this campaign in Nigeria, we have selected nominated zonal coordinators within the 6 geopolitical zones in Nigeria. We have gone on to select 4 state coordinators that will coordinate the 36 states and the FCT in Nigeria. And we are also making effort to meet the ministers of health, the Senate president, and the chairman committee on drugs and narcotics in both chambers of the Senate and House of Representatives. Our reason for doing this is to make sure that our government see reasons to accept this declaration and pass it as a piece of legislation so that prevention can have at least 25% of drug demand reduction budget in Nigeria. So this is how far we have gone, and believing that very soon it will be the entire Nigeria will be part of this global campaign. Thank you very much.
Thank you so much, my brother Chris. Thank you for the work you do in Nigeria, mobilizing people and making sure that people at least can help to protect, to prevent children before they graduate into other problems. I've seen most of your work. I've visited Nigeria and I'm really impressed. Mr. Orio, I want to invite you that you take over for these next 5 minutes.
Well, thanks. Also impressive the work Chris is doing in Nigeria. It is as impressive as the long-standing career of George Ochieng from Kenya. He's been working on the field for many years, although he looks very, very young. He's the executive director of Islam Child Foundation and vice president also, and this is very important, from the recent established African Civil Society Forum on Drugs, and also the focal point of this preventive initiative in Kenya. So very happy also to have here in this event. It's
Thank you very much, Orio, for the opportunity to be here. When I got the invite, I was very much impressed, and I said I'll try to give an overview of where I'm coming from and maybe the continental perspective, and I will sum it up with a way forward. So one of the shocking information that I have is that drug use in Kenya since 2019 has been on the increase. If you look at 2012 to 2017, there was a decrease. But that said, I think it's high time we, the civil society, need to do something. And I'm very much happy with the Orio, the Oviedo declaration, because it will be able to help us pin down the government and tell the government they need to do something. In Kenya, we have around 5 million people who are on drugs, and it is so sad that if you do a random sampling, 1 in every 3 male persons between the ages of 15 to 65 are using drugs. The median age in Kenya of drug use is around, I think, 6 or 7. And then 1 in every 15 Kenyans are using multiple drugs. The most common drugs in Kenya, we have tobacco, bang, cat, alcohol, and there is also politics about, we call it cat. But that said, the other shocking information is that when it comes to alcohol, you realize that 1 in every 8 Kenyans, there is one using alcohol. This sums up to a total of around 3 million drug users. I mean, 3 million people who are using alcohol alone. If you go to tobacco, we have 1 in every 12, which total to around 2 million. If you go to cat, 1 in every 28, which is close to 1 million. If you come to cannabis, you realize that 1 in every 53, which total to around 500,000. This is a very sad, shocking information. And if you look at the median age, the average age for the most affected population remains to be young people. You have the children, the youth, and the women. And the youth, who remains to be the backbone, are the worst affected, because we are talking around between 60 to 70% of like the total population. The youth make up that number, and they're the most affected. When we talk about the 5 million, we realize that they take the lion's share. The children are not spared, the women are not spared. And Giovanna said that women, the drug use among women is also, and it's on the increase every single day. It is not, there is no difference. I mean, that is what I encounter every single day. And if, like every single day when I come home, I must encounter 2 to 3 people sleeping by the roadside. Either they're using injected drugs, or they're using alcohol, bang, and so on and so forth. I wouldn't focus so much on that, but I wanted to give a picture of how the situation is on the ground. But I have a way forward. And this, whatever I'm saying, is more or less the same with what is happening in Uganda, in Egypt, Nigeria, South Africa, Zambia, Malawi, and so on and so forth. So we remain to be affected population, but something needs to be done, which I would want to really encourage. One is, as member state, and I love what Chris, my good friend, is doing in Nigeria, we need to put to task countries that are within our continent, and give them the facts the way I've mentioned, and tell them the solution is this. We have the Oviedo Declaration. Is there a way that you guys can find a room to ensure that this is implemented together with the policies? The Cairo Declaration that Dr. Abel mentioned. If we're able to put all this together and come up with something, we'll be able to help the young population that is affected by drugs. Being a drug prevention influencer, I would really, really push for us to promote drug prevention. It saves a lot, and it's very cheap. Interventions are there, they are on the grassroots level. We need to borrow notes. If you go to Uganda, there's something you can borrow. If you go to Nigeria, there's something you can borrow. If you come to Kenya, where I work, we need to borrow these interventions that are working out with the guidance of UNODC, the manual that Giovanna talked about. If we're able to have that, it will be easier for us to have an evidence-based intervention. We need to lobby for funding again, because we cannot do this with the little funding that are there. We need to lobby for them so that we are able to build the capacity of young people, because they are the ones who are affected. Then last is partnership. We need to put the government and the civil society in one room and on one table, so that we are able to save our country. So that is it from my end. I know time is not on my end, but that is it from my side. Thank you very much.
Thanks, George. I wish you the best.
Yeah.
Okay. Time is not on our side, but like we noted, we want to give 5 minutes to each person. and then see what's coming up. I'm now going to invite somebody from Southern Africa. We've been to West Africa, we've been to East Africa. Now let's go to South Africa. I'm going to invite Chantel Pepper. Chantel Pepper is who works currently in the Western Cape Substance Use Forum in South Africa. Chantel, we met, we discussed, we talked recently. Chantel also, is very interested in the working group, gender working group to say prevention in WFAD, but also work in the ITT Center. So Chantel, please share with us briefly in 5 minutes your views. Thank you very much.
Thank you so much, Roger. Thank you. Good afternoon, colleagues. Oriel, for arranging all of this, and to my fellow panelists as well, and everybody that's listening. Thank you so much for this opportunity. I really enjoy, when I can connect and contribute to the global narrative and conversation that affects us all really on our daily lives. So like Roger said, I'm from South Africa. I'm based in Cape Town. Therefore, I cover the Western Province. That's why I'm chair for the Western Cape Substance Abuse Forum. And I'm very much involved on the ground, working with municipalities, the civil society, and I really want to latch on to what my previous panelists said, is that my role really is to get both government and civil society in one room. And, when I started this journey, the Prevention Science International Standards really was just developed 2013, I think. And therefore, a lot of focus in South Africa in general was really focused on treatment. So when I joined the field, it was a lot about treatment, especially inpatient treatment. And over the decades now, I'm very pleased to say, because we did a study with UNODC at the time, we really looked at what is the needs of our adolescents, particularly school learners. And from that, we discovered that a lot of the school learners start using, in primary school level, and this really impacted on how we fund our organizations moving forward. So I'm pleased to say that one of our funded organizations are on the call. As Department of Social Development, my role is to connect the department with our civil organizations, the NGOs, as well as the municipalities. And colleagues, I really want to just emphasize on this, that I wouldn't be able to do what I do if we didn't have a stable government, in terms of, just knowing that going to the mayor, because of the stability that they've created within the municipalities with governance and really focusing on service delivery, we then branch out and give them an understanding of why it is that they need to take ownership of the alcohol and drug problems within their own communities. So that is why I say the connection and policymakers' role really is to connect the civil society and implement legislation from nationally all the way down to the ground, and capacitate mayors, capacitate the ministers, of that portfolio, like social development, or also called the social welfare and health department, as well as education and agriculture, economic development. So in my forum, we all have these role players on the forum, meaning their particular, department is then focused on how they incorporate our interventions with the current, evidence-based programs that is out there. We also try to focus a lot more now on prevention in South Africa, because we realize now prevention really is key. And working just with my municipalities and their civil society, going onto the ground, particularly municipality by municipality, is the only way we will understand what those needs are of that particular community. So I'm very blessed in, to have a political support. I have my head of department supporting me, and I now have great municipalities that are employing the UNODC international standards. Whatever I get taught, I pass it on, and I capacitate the civil society on the ground. I mean, this is how they are able to actually implement prevention programs or early intervention and aftercare and treatment, for example. So really in South Africa, we understand now prevention really is key. We also have school programs that we also run, that is more raising awareness. And it really is what Giovanni also said. It was like you said last week at our training, at the URC training, is that it's a whole society approach. And this is what our national legislation is really prescribing us to do, the National Drug Master Plan of South Africa and our Prevention of Treatment and Substance Use Act. You see, our act even starts with prevention. And in our act legislation and in our National Drug Master Plan, it's prescribed that we do target children and families, youth, community levels, vulnerable people like homeless people, etc. So, legislation is really first and foremost the key. Then how do you implement that legislation at a provincial level as well as a local level in partnership with your municipalities as well as your civil society organizations who are actually doing the work. We do have state-funded in treatment programs as well. However, what we're talking about now is prevention, and where does prevention really start? It's at the family, at the community. So we have family strengthening programs that the City of Cape Town has also implemented for a couple of years now, and that's also an evidence-based prevention program. We also have one of our funded organizations that work within the schools recently did a prevention curriculum training as well, and she already is doing that sort of work. So our funded organizations that also speak to the fetal alcohol spectrum disorder, they do great work. They call STAR. They also do research first, then they do their prevention, interventions, and evidence-based prevention programs. So we really have got quite a few organizations that does either awareness raising, prevention programs in hotspot areas, which is high risk areas, but they work well with law enforcement, police, South African police, and they all basically do interventions, raise awareness, but also prevention programs, that they work with the social workers, because like Giovanni also said, we have to protect the child, and that is what social welfare and development is about, is child protection first and foremost. And how do we assist women, and their children to receive that treatment that is so desperately needed. And that's why we also have women-only treatment centers where we provide that safe space for women and their children so that we can break that intergenerational cycle of trauma and therefore provide them with the relevant and key interventions to get them really recovered and back into society. And that's really, in a nutshell, how South Africa is approaching, well, in the Western Cape as well. And of course, South Africa is massive, it's big, we have 9 provinces. So every province has their own way of implementing the National Drug Master Plan, but ultimately that is our guide, and that is what we use in each province and how we implement our prevention programs on the ground. Thank you, colleagues.
Okay, Oreo, over to you.
Well, first of all, thank you very much, Antel. I have to say that we did an exception with you because all our speakers are focal points from each country, but we really wanted to definitely have her on board today to share what we consider one of the greatest best practices on this field. So thank you so much, Antel. Hopefully you can be the focal point in South Africa maybe, but that's another matter. Okay, now we move on to the next speaker, James Collier from Liberia. He's the executive director of the Global Action for Sustainable Development, one of the most renowned organizations in Liberia, a dedicated advocate for evidence-based drug prevention and drug policy reform, bringing over a decade of experience to his work in Liberia. Also the focal point of this initiative from this country. So thank you so much. You have the floor, James.
Thank you, everyone, on this Africa hearing. Pleased to be here today, and I would just highlight focusing on Liberia, looking at the historical context, looking at legal reforms, and what we have been doing on the ground as an institution over the period. We have been actively involved with substance use prevention programs and drugs policy reform advocacy since 2014 as an institution. So you know that Liberia has a terrible past. We have civil wars, And since the end of the Civil War, we have had a high level of increase in substance use among young people. So proud to the 20, 2014, Liberia didn't have specific laws that address the issue of substance abuse. So we have the public health law that in Liberia that struggled to keep pace with the evolving drugs abuse landscape. So the public health law with forms the bedrock of health governance in Liberia, has been pivotal in addressing health issues, but as limited provisions directly targeting substance use prevention. So in 2014, Liberia enacted a first comprehensive drug law, which aimed to curb the proliferation of substance use, illegal drugs, and provide a framework for rehabilitation and reintegration of drug users. However, the law primarily focused on punitive measures rather than preventive strategies, limiting its overall strategies and effectiveness. So the law is also has some shortcomings. So there was advocacy around that, and then in 2023, in response to the evolving drug crisis, Liberia amended its drugs law that now look at the issue of crucial steps incorporating significant updates to address the gap in the 2014 legislation. But as all these reforms have been going on, despite these advancements, the law still falls short of providing clear, comprehensive strategies for substance use prevention. So that's why we have critical gaps in prevention. Um, and to have effective programs, we know that we should look at multifaceted approaches, including public education, community engagement. But currently, there is no unified framework guiding these efforts as the different laws have been made. So we have a fragmented and often ineffective initiative. The lack of clarity and consistency in prevention policy. It also undermines the effort to address the root causes of substance abuse prevention in Liberia. Um, so, as an institution, in fact, on in January of this year, the Liberian government, through the new president, His Excellency Joseph Yuma Boakai, declared substance abuse as a national health emergency. But we don't see it clearly. It may be manifested in the national budget. So because we are talking about the different things we are doing and how we want to approach it, but resources is very important. So the declaration of Oviedo was recently presented in Liberia on June 20th in commemoration. We had a program in commemoration of the International Drug Day, and we were glad to have Oreo presenting the declaration as well. And we were able to present it to the Liberian government through the Ministry of Health, and also to the national legislature through a honorable representative of one of the counties, Grand Bassa County District 5, who also chairs the Hawks Committee on Substance Use Prevention. So at this stage, what we are doing now is building consensus, establishing partnership with key stakeholders to ensure that we can use the declaration of Oviedo as a foundational document that we can push to have a national drugs prevention policy. Because as I speak, our laws does not speak to that. More emphasis are placed on treatment, more emphasis are placed on law enforcement. So prevention is key. And to just conclude from my end here, it is key that we continue to look at collaborations, government and stakeholders need to partner with civil society institutions and international institutions that can also provide additional resources and expertise. Also, strengthening data collection and research is also key. These are critical areas that are lacking in our country, and we believe that establishing strong partnerships will help to address some of these issues. That we all have agreed that, like the recent team for the International Drug Day, that the evidence is clear. So, evidence-based drug prevention, these are interventions that work. We just need to advocate for investment in those in the sector. Thank you.
Thank you so much, James. Rogers.
I think we are left with like 2-3 speakers before we invite our Vienna NGO committee to say something. But now allow me to invite Farida. I think Farida is representing also, a broad area of looking at substance use, and she's coming from Benin, and she has been working in that area, in the area of mobilizing organization, platform for civil society organization, and she's the executive director for civic engagement, for research and development. Frida, share with us briefly, in 5 minutes, don't exceed because we are running out of time. What is your experience and how you see the things? Thank you very much.
Okay, thank you, Oriol, for giving me these opportunities. Thank you, Rogers, for giving me these opportunities. First of all, I want to present the situation of drug uses in Benin, the measures that have been addressed, and finally, the challenges we are currently facing in Benin country. So, located in West Africa, a few years ago, Benin was considered as transit country for drug, but today it has become not only a transit country, but also a production and consumption country. Drug use among young people in Benin is increasing every day, especially for tramadol, alcohol, and cannabis. And 45% of drug users are young people between the ages of 16 and 24 in my country. This situation will exacerbate the country poverty, and to address this drug situation, several laws have been adopted in my country. Since 2010, the Beninese government have been working to improve the legal and institutional framework for the fight against drugs. We have, for example, the development and validation of the National Integrated Plan to combat drug trafficking, drug abuse, and organized crime. We also have the creation of institutions such as Interministerial Mission for the fight against the abuse of narcotics and psychotropic substances that have been tasked with leading fights against drug trafficking. Despite these measures, Benin is currently facing challenges, among which we have first, the interception and incineration of drugs that are positive measures, but they are not enough to dismantle the trafficking network in Benin. Second, we have the increase of tramadol and new psychosubstances that really need to develop research and appropriate prevention intervention. Third, we have the lack of resources to implement evidence-based prevention intervention. Furthermore, weakness in the management of Benin's land and sea borders at various levels is an important challenge to overcome. In addition to the lack of research and effective system of information on drugs, we need in Benin to tackle the socio-economic roots that causes and fuel the illicit trade at the local level. Moreover, regular meeting with different stakeholders, including civil society's actors for drug system, is really needed, associated also to school-based program and strengthening family program. We really need that. Finally, there is a need for specialist trained staff for the implementation of the prevention intervention in country. So overcoming these challenges will help Benin government to to overcome drugs utilization or drug addiction in my country. That's what I can share with you about the current challenges and also a brief solution that we can use for drug prevention in Benin. Thank you.
Well, thank you so much, Frida. Let me add a couple of things. First, that it is important also to push for women leadership throughout the region. So I think you are one of the proponents of it, for sure, in West Africa, but also that you are a researcher of the University of Abomey in Benin, and I also want to take this opportunity to stress also this important collaboration with academia, because we can both gain a lot. Civil society organizations working on the ground, and academia or scientific groups that can support what we like, and vice versa. So thank you so much, Frida.
Thank you, Oriol. Thank you. It was a pleasure.
So it is my turn. We are working, Rogers and myself, in couple, because it's somehow also a way to show that we work collaboratively in a jointly way. All this initiative, we are all doing this on a voluntary basis. So it is, to me, very, very, very powerful. Our next speaker comes from Zimbabwe, Romeo Machaki, a drug prevention specialist, an accredited addiction therapist, a drug and substance abuse counselor, and most importantly today, representing as a founder and executive director of Active Youth Zimbabwe. Romeo, thank you so much for being here with us today. You have the floor. Romeo here.
Yes. Can you hear me?
Yes.
Hello? Yes. Okay. Thank you so much. Okay. Thank you so much for the opportunity I'm given to share the drug use in my country. In the country here, no one questions the severity of a drug problem and its devastating impact on youth. In schools, academic results suffer, and even worse, drugs undermine health and destroy young lives.
Romeo,
Yes.
your camera is also off, eh? Like Chris.
Yes,
No.
let me. Okay, I'm sorry about that.
But you can continue without camera. I was just noticing in case it was off. Eh? Okay,
It's
okay.
fine.
You can continue.
Well, thank you so much. Like I was saying that the drug abuse in the country is so rampant, and young drug users, they suffer more illness, they miss more days of school, and they are more prone to engage in criminal conduct. And the most disturbing aspect of this problem is how drug abuse our youth and the threat this poses to the future of our country. Physically, there are also healthy effects related to drug abuse, such as accidental injuries, physical disability, diseases, and possible overdose, which result to drug-related suicide, homicides, accidents, and illnesses, especially when it comes to mental health. We realize that most of the victims who abuse drugs, they are admitted to mental health institutions as a way of for them to get recovery. Socially, youth who use alcohol and other related drugs may be eliminated from and stigmatized by their peers. They often disengage from school and community activities because of their substance abuse, depriving their peers and communities of the positive contributions they might otherwise make. Drug and substance abuse also jeopardize many aspects of family lives and any result in dysfunctional families. According to the statistics which were carried out just this previous year, they show that 60% of school dropouts across Zimbabwe are a result of substance abuse. According to the same research, most common drug abuse by students were cannabis, meaning that marijuana is the commonly abused drug in the country, followed by coffee syrup, the coffee syrups, which are at 47%, and illegal alcohol, which is at 31%. Pharmaceuticals, they goes up to 13%, and crack cocaine, which is at 3%. Cocaine powder, which also goes at 3%. As an organization, Active Youth Zimbabwe, we normally receive calls from the families who are in need of the rehabilitation and family support, meaning that in this month, June, the past month, the previous month, we got 27 contacts, people inquiring about our services, and this shows that drug abuse is so alarming and is so rampant in the country. And as a solution, we call upon our stakeholders in the country, together with our government, as well as our law enforcement officials, to adopt this international standards that address drug prevention, rehabilitation, treatment services for the benefit of the country. We also call upon our government to work closely with global initiative on drug use and prevention, so that the whole country can benefit from this initiative of fighting drug abuse. We also encourage the government to come up with 10 policies that tighten and punish those people who are found peddling, trafficking, and dealing with drug and substance abuse. More so, the government and the stakeholders jointly, we should come up with proper affordable treatment facilities on drug, because we realize that currently the drug rehabilitation centers that we have, they are privately owned and they are more expensive. If the government can intervene and introduce drug treatment facilities with the help of international organizations and collaborations, so that we implement these drug-related prevention activities as a way of keeping and fighting drug abuse, since we know that the weapon in the war of fighting drugs, it is education. Education, it is the key. I think that's all I have for the meantime. I thank you for the time that I was given.
Okay, thank you very much, Romeo. Can we now hear from Dr. Tewabe Bayu, who is a medical doctor from Ethiopia, co-founder and CEO of the community boosting organization, a non-profit organization, which is led by young people and young physicians working on health education. So Dr. Tewabe, please, can you join us and help us to see the perspective? And actually, Dr. Tewabe will be the last, and then we invite Dr. Matej Kosel to come in and share. We want also to inform you that we'll be organizing a Francophone for French-speaking countries, a webinar which will be communicated via the communication and the email. So Dr. Tewabe, please, I'm giving 5 minutes. Please share kindly with us. Thank you very much.
Okay, thank you very much for this opportunity. Let me go directly to the issue. Ethiopia is facing lots of challenges considering the drug prevention. The first and the top one is just lack of awareness among the community. The community consider chat, alcohol, and tobacco as unacceptable issues. So the community will use widely, and these drugs are culturally acceptable. So the prevention will be a challenge. Then internal conflicts are also the other challenges in the country. As you know, Ethiopia is in civil war or internal conflict in the last 3 years. So for the community and the professionals and the civil society organizations working in the civil war is a challenge. Furthermore, a strong social stigma surrounding use of extraordinary drugs and seeking medical attention for this drug use is also considered as a stigma. So no one will come for medical care when he have challenge with drug use. And there is also high limitation in data collections, and there is a limited information about the prevalence and other information considering drug issue. And there is also treatment gaps. There are a few rehabilitation centers in the country, and there are few civil society organizations working on the issue. So there is a shortage considering this. And there is also new emerging drugs like benzene and tramadol among health professionals. So beside the widely used drugs like chat, alcohol, and tobacco, these newly emerging drugs are also challenging the prevention work. So among these all challenges, civil society organizations and the Minister of Health are trying to get solutions. The first one is integration of mental health in the primary health care. In the last decades, mental health was not part of the primary health care. You will not going to find health professionals working on this issue. So now civil society organizations and Minister of Health are trying to integrate this mental health services in the primary health care, like in the health centers in the local areas. And also some NGOs are trying to reach the users using mobile phones, social media, and telecom messages, which are reaching the users. Of course, there are also difficulties in the conflict zones because we have internet shutdowns around there. And also as a solution, beside things which are already done, there are also shortage of resources. Specifically, there is after the era of the conflict area, the NGOs, international NGOs, are stopping their work in the country. So we need collaborations, networking in order to work together. And the declaration of Oviedo will be one of the tools to go forward, to work together. So we need collaborations, fundings, and also we have International African Union in Ethiopia and other international organizations in Ethiopia. So these organizations are expected to influence the governmental bodies in order to work on the conflict issues, in order to stop conflicts, in order to avoid civil wars, because they are the base for the last 3 years increasing use of drug use among users. Thank you for the opportunity.
Okay.
Audio, over to you.
Yes, let me add just one thing that yeah, we are very happy to have also Ethiopia on board, but precisely Dr. Bayu, because he has translated into Amharic, one of the 2 official languages in Ethiopia, the declaration. He's already reviewing it. So on the following days, every one of you on the official website of this initiative can download the declaration, not only in Amharic, but the rest of languages. Thank you so much. And I think I would move to introduce the Matei Kosir, who will do the closing remarks. Then we will try to respond a few messages or questions posted in the chat box before the closing. Well, we are so pleased to have Matei. Matei Kosir, I don't know if you know, but he as chair of the Vienna NGO committee. I'm not sure if there's something above. So this is the umbrella organization, federation that encompasses all like more than 400 organizations that are taking actively part at the UN level in the field of drugs. And so that's why this is for us very enriching also having him here today. He's the director of the Institute UTRIP from Slovenia, an European country, and the coordinator of the National Prevention Network in Slovenia called Prevention Platform. He's probably the chair of the VNNG committee because he's been working in prevention and advocacy in the field of substance use and other risk behaviors and addictions for about 25 years. Matej, you have the floor.
Thank you very much for a very nice presentation and introduction. Yes, I'm also, I must say that the Vienna NGOC is a proud observer of Oviedo Declaration. So we will follow the progress of Oviedo Declaration in our activities. And we are also proud to be part of this African hearing. There are several reasons for that. First, I would like to start with presenting some facts. As many of you know, there was a process, a global consultation process for the midterm review end of last year and beginning of this year. And prevention was recognized as one of the key topics for the future of drug policy. Among key conclusions and recommendations, it's quite clear that we should invest more in evidence-based prevention and to build capacity at the different levels to implement evidence-based, not just prevention, but also other interventions in the field of drug demand reduction. And I must say that related to the global consultation, there was a global survey and a lot of respondents and inputs came from Africa. It's very surprisingly, but I'm not surprised because I know now the numbers, how many NGOs and other stakeholders signed the Oviedo Declaration from Africa. So I think it's almost half of the signatures are from Africa, and NGOs are from Africa. And also as a part of the our work and our initiatives, we initiated together with the African Union Commission and the African Vienna NGOC African Ad Hoc Working Group, establishment of African Civil Society Forum on Drugs, which is now in the process of mapping of different civil society organizations in the field of drug policy in Africa. And we have already more than 800 contacts from African civil society organizations. So this is a huge investment, and we plan to organize several activities for African civil society organizations, including in the field of prevention. And this hearing for the Oviedo Declaration is a good example how we try to upgrade the work in prevention in African continent. Especially because we know that a lot of prevention interventions, not only in Africa, but also in other continents as well, are not really evidence-based. Sometimes are not just ineffective, but there are still a lot of harmful so-called prevention interventions around. So based on the international standards, and Giovanna presented this quite well, and we recommend you to read those international prevention standards. We have to improve implementation of these international standards, because it's not a problem. There is motivation. There are a lot of people willing to do a lot in prevention, but the problem and the challenge is that we have to switch to evidence-based prevention, to what works, and to leave behind what doesn't work or might even be harmful to our target populations when we speak about prevention work. And also last week, as you may know, the UNODC actually launched the World Drug Report, and there are a lot of indicators, and the situation looks really bad. If we look at the situation in the field of drugs globally, mostly focusing on supply reduction indicators. And we as a civil society organizations and Vienna NGOC as a global platform in the field of drug policy, we initiated to the UNODC several times already that they should include more prevention and also recovery-related indicators, which would, I pretty much believe in that, which would show the situation in the field of drugs a little bit less warning, less concerning, a little bit better, because we know there are several very good examples and also data which shows effectiveness of prevention programs. And if that would be presented as a case studies in the World Drug Report, the situation wouldn't seem so bad, globally speaking. And also, I would like to mention and close this. We are also planning, and we initiated so-called Impact Coalition for the future of drug policy to showcase some good example, not just civil society-oriented initiatives, but we want to introduce much broader perspective and approach, which means that civil society is strongly connected with member states, with UN agencies, and also with academia. And Oviedo Declaration is one of the exceptional good examples of this kind of collaboration and approach, which brings together not just civil society organizations, but UN agencies like UNODC, WHO, member states. You have a lot of focal points in different member states. And also the declaration being translated into many, many languages. And also academia is involved in Oviedo Declaration. So congratulations for this, I would say, initiative which came before the Impact Coalition with this broader approach was initiated and established. And thanks to you, we are learning from you, and we know now what are the future challenges for us. We would like to share and disseminate this good example also to other fields, also to the field of treatment, recovery, harm reduction, access to essential medicines, and many others. You're showcasing how it's possible to build good relationship and collaboration between civil society, member states, UN agencies, and academia as well. So thank you very much. And I would like to close with this.
Thanks, Matei. To have you here is very important. Not only today, but joining us within all this journey, which is very, important, because we need you, and we need also the BNNGO Committee on Drugs behind. Before Rogers close more formally the meeting by saying goodbye, we went through the messages of the chat box, hundreds of messages. Some of them are very nice, welcoming the initiative, but also sharing the contact data. So this is a good consequence of staying together in this initiative. Then some of the requests, we'll try to summarize, are related to what's next, what are the next steps that we can undertake using this declaration, or is there any funding, or are there any trainings that we can benefit from, etc. So I would tell first that use as much as you can this instrument, which is this proposals, this declaration, which goes beyond. So it's a global force that are saying the same. So it's not only you and your organization that believes in it, that as long as you can get more endorsements in your country, you are reinforcing this mobilization. And if you connect it with a global mobilization, I think may be very useful for you to influence policy making. But also we are organizing more national events. For instance, on Friday we will make a 1-hour meeting with organizations in Rwanda. So we present the declaration in a more detail, the proposals, and we make a discussion. We can even provide short trainings on prevention. On the 24th, we will do the same in Tanzania. So come to us, reach out to us, and we can try to establish also nationwide meetings to advocate somehow with your particular also needs, okay? But also, yes, of course, in a mid-long term, as I think though all this mobilization should also be related with more capacity, more funding at all levels. So as more as we can keep on pushing, I think it's a matter of fact that policies should incorporate or donors or other private sources should also look at prevention in a positive eye. Well, I will give pass the. Is it Roger here? Rogers? He's not here.
Okay.
Yes.
Yes, I'm coming back to you first of all to express our appreciation for the high turn-up, so that we can push further the message on prevention. I know UNODC are pushing for this. Everybody is pushing for this. The World Federation is pushing for this because of the experience. And we save money. We save young people. We are able to direct young people into productive work. We keep young people safe and healthy. Of course, I know some will eventually end up in drug use, but if there's a way of preventing, that would be very good. So we are very grateful for the project, for the Project Combo for this, but also we are very grateful for the hearing, which has enabled us to be able to hear about the declaration on prevention. I wish Cressida could post it here so that the people see and are able to visit and encourage other colleagues to sign. We need many, many members. And I wish one day you people, Olio and others, and Giovanna, we can push this to the UN General Assembly so that governments not only stop at promising, stop at telling us that we are going to do prevention, but governments can commit money towards prevention. Many times they tell us they are doing education, they are doing this and that, but we want to see commitment of resources towards addressing drug use, drug prevention. And that's the way how we'll be able to do it. That's the way how we'll be able to manage. So thank you so much. Thank you so much. Spread the message. Olio, do you want to say anything quickly?
I think it's fine. Eh? You are doing the closing very well.
Thank you for trusting me on behalf of Africa. I'm also aware that George from Slum Aid, working with Maria, have been working on the African civil society platforms, where we intend to do many things more than this. The first one we have promoted is prevention. We'll be working on other areas to ensure that we build the capacity within our region so that our people are able to address the issues of drugs, the issue of drug use, prevention, treatment, and even other areas. We'll be looking at them. So members, please look at the platform. And thank you others who have come. I've seen Augusto as far as Southeast Asia, Augusto and many others from Pakistan. Thank you for standing with us. I think Africa needs prevention. Thank you so much. Hope to see you soon. Thank you, Dandy from Congo for reporting, Sonja for reporting. People are looking for the report. Share the report so that me and Georgia, we can post it on the African Civil Society platform. Thank you very much, and wish you a nice day. Bye-bye, everyone.
Thank you, Roger. Thank you, Oriel.
Thank you.
Great
Bye.
to be
Bye,
here.
everyone. Thanks.
Bye.
Okay.
Goodbye.